Hey everyone, welcome back to Trove Direct. Across the United States, from bustling urban centers to serene rural landscapes, a hidden danger, unseen and often unacknowledged, is silently drifting through the very air we breathe. It's a constant presence, a microscopic inhabitant of our environment, a fungus called Aspergillus fumigatus. This opportunistic pathogen is more prevalent than many realize. For most healthy people, with robust immune defenses, inhaling its spores poses little to no risk. It's a natural part of our interaction with the environment, but for those with weakened immune systems, the elderly or individuals already battling illness, it can trigger a deadly lung infection known as aspergillosis, a condition that demands immediate medical attention. This infection is aggressive and insidious, often spreading rapidly from the initial site in the lungs to other vital organs throughout the body, complicating treatment and recovery, and unfortunately, it has alarmingly high mortality rates, making it a significant concern for healthcare professionals. What makes Aspergillus fumigatus especially dangerous and difficult to combat is its inherent invisibility. You simply can't see it with the naked eye, smell its presence, or easily avoid its pervasive spores. The World Health Organization now officially lists it as a critical fungal threat to global health due to its rising drug resistance to common treatments and its expanding geographical reach across the globe. This once manageable mold is rapidly evolving and adapting, transforming into a formidable public health adversary that requires our urgent attention and proactive strategies. Understanding the complexities of this invisible threat, its transmission, and its impact is the crucial first step in developing effective strategies for protecting those most vulnerable and at risk from its devastating effects. Aspergillus fumigatus, a common mold, spreads mainly through the air, its microscopic spores easily becoming airborne. These spores are incredibly light and can travel vast distances. These spores are persistent, settling everywhere, from the soil outdoors to the seemingly clean indoor surfaces of our furniture. They are virtually ubiquitous in our environment. Most people breathe them in daily without harm, their immune systems effectively neutralizing the threat. However, those with compromised immune systems, like cancer patients undergoing chemotherapy, transplant recipients taking immunosuppressants, or people with chronic lung diseases such as COPD or cystic fibrosis, face a significantly increased risk of developing aspergillosis. High-exposure environments also pose a greater risk. These include construction sites, where dust is constantly stirred up, compost piles teeming with organic matter, and anywhere mold thrives, particularly in damp or poorly ventilated areas. Farmers, gardeners, and construction workers are especially vulnerable to inhaling large quantities of these spores. This is due to their frequent contact with soil and dust, which are prime breeding grounds for Aspergillus. Even healthy people can be affected if exposed to large amounts of spores over a prolonged period, sometimes triggering allergic reactions, such as allergic bronchopulmonary aspergillosis, or in rare cases, more serious invasive infections. Tracking aspergillosis and its prevalence is difficult, primarily because it's not currently classified as a reportable disease in many regions. This lack of mandatory reporting leaves public health officials with limited data and a fragmented understanding of the disease's impact. This lack of comprehensive surveillance makes it challenging to accurately grasp the true scale of the threat and implement effective preventative measures. The intersection of climate change and modern agricultural practices presents a complex challenge. These factors are inadvertently contributing to making Aspergillus fumigatus, a common environmental fungus, increasingly dangerous to human health. Rising global temperatures are expanding the fungus's habitable range, allowing it to thrive in regions where it was previously less common. This is especially concerning in warmer, wetter regions, which provide ideal breeding grounds for the fungus. A prime example is the southern United States, where the fungus is becoming more prevalent. Furthermore, as the fungus adapts to survive in increasingly higher temperatures, it's undergoing concerning evolutionary changes. This adaptation may inadvertently make it better at surviving inside the human body, potentially leading to more severe infections. This poses a significant threat, as it could weaken our natural defenses against fungal infections. In parallel, the widespread use of azole fungicides on farms intended to protect crops is having unintended consequences. This practice is inadvertently driving the development of drug resistance in Aspergillus fumigatus. These agricultural chemicals share similarities with the medicines doctors rely on to treat aspergillosis in humans. Consequently, resistant strains emerging in the environment can significantly complicate the treatment of human infections, making them harder to manage. Worryingly, drug-resistant Aspergillus has now been identified in multiple states across the country, highlighting the growing scope of this problem. This is effectively transforming what was intended as a farming solution into a potential medical crisis. When standard treatments prove ineffective against these resistant infections, patients are left with increasingly limited and riskier treatment options, impacting their chances of recovery. Therefore, our current efforts to protect crops, while essential, are inadvertently fueling a new and concerning wave of hard-to-treat, drug-resistant infections, demanding a re-evaluation of our strategies. Since Aspergillus fumigatus is everywhere, total avoidance isn't possible, but high-risk individuals can take steps to reduce exposure. Doctors recommend avoiding gardening compost and dusty environments if you're immunocompromised. If exposure is unavoidable, wearing an N95 mask can help filter out dangerous spores. At home, using HEPA filters and controlling humidity can limit mold growth and airborne spores. Hospitals use strict air filtration for vulnerable patients. Similar precautions at home can help. Stay alert for symptoms like persistent cough, fever, or chest pain, and seek medical care quickly if they appear. Regular check-ins with your doctor are crucial for those with weakened immune systems or chronic lung disease. Early action can mean the difference between recovery and a life-threatening infection. Awareness is our strongest defense against Aspergillus fumigatus. This fungus is part of our ecosystem, and its threat is growing due to climate change and agricultural practices. Public understanding helps vulnerable people take protective steps and encourages better health policies. Making aspergillosis a reportable disease would improve tracking and response. We need a One Health approach, linking human, animal, and environmental health to manage drug resistance and protect vital medicines. Collaboration between doctors, farmers, and policymakers is essential for smarter, sustainable solutions. Individual vigilance, robust surveillance, and medical innovation are all needed to stay ahead of this evolving threat. By working together and staying informed, we can reduce the deadly impact of this invisible adversary. Don't forget to like, subscribe, and share the video.